The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Heart attack, one of the leading killers in America. It can be treated and prevented, but the latest treatments may not be the greatest. The war on cancer, AIDS, and other killers rages on, but new drug technology may help turn the tide. Tiny bacteria can cause enormous pain when they cause an infection in your urinary tract, but you can fight back. Get right to the heart of matters affecting your life on Today's Health.
You've heard the phrase, keep it simple. Well, that rule can and should be applied to medicine. Sometimes in their quest for more effective treatments, doctors overlook the tried and true good ones. Hello, I'm Kathleen Sullivan, and this is Today's Health. Older medications are constantly being updated, but newer is not necessarily better.
In the consumer jungle, most of us have figured out that new does not necessarily mean better, and complicated isn't always the most effective way to go. In treating patients who have had heart attacks or are at risk for them, it can often be the same.
Disorders of the heart kill more Americans than any other disease. They can arise from congenital defects, infection, narrowing of the arteries, high blood pressure, or disturbances of heart rhythms.
The major cause of heart disease in most Western civilizations is coronary artery disease, which is created by atherosclerosis. Atherosclerosis is a process that takes part inside of the coronary artery. Blood cholesterol and particles of cholesterol infiltrate the lining of the artery, and from reaction with molecules and cells in the wall of that lining, a plaque builds up which begins to obstruct the coronary artery.
The LDL cholesterol builds up an active, unstable plaque which forms a bump on the artery wall. If the plaque ruptures, sometimes blood clots around it, as it would any scrape or cut. That clot, or the loose plaque from the ruptured lump, can clog an artery and block the blood supply to the heart.
Thrombolytic therapy is a chemical that goes into the clot. If you remove the obstruction to blood flow and restore the oxygen in less than 6 or even 12 hours, the heart muscle often can be saved.
They gave me intracoronary streptokinase when they did the angiogram on me. The clotbuster therapy worked out great. Just wonderful. I mean, it's been 5.5 years and everything's just wonderful.
Even though it's a life-threatening event, treating a heart attack does not usually require the most advanced or expensive drugs modern medicine has to offer.
The cost-effective therapies for cardiovascular conditions, which probably the most common are high blood pressure, stroke, and heart attack, would include the use of aspirin, the use of beta blocker class of drugs for treating either high blood pressure or heart attack, and more recently the use of ACE inhibitor pharmaceuticals. Taking an aspirin acutely or rapidly with a heart attack is not a new therapy. It's only that in the past 10 years we realize what great benefit it is.
When dealing with people's lives, it's not important that the treatment be expensive or even cutting edge. What matters is that it helps prolong the life of the patient and prevents future events.
This planet may have limited amounts of precious resources like natural gas, but there is one thing that is unlimited in this world, and that's medical opinions. Opinions, theories, hypotheses, they do abound. But the only ones with substance are the ones that are backed up by clinical research and statistical data.
To someone with no medical training, beta blockers and ACE inhibitors may sound like very complex, cutting-edge treatments. But along with aspirin therapy, they have been part of an effective pharmaceutical toolbox available to doctors treating cardiovascular patients for many years.
Okay, they're proven, they're effective, and they're relatively inexpensive. It seems only logical that most physicians treating cardiovascular disease or hypertension would use these therapies most of the time. But that's the enigma. They don't.
Many of these agents are not being used properly by the practicing physician in the community because we had not stressed the importance of, if you will, evidence-based therapy. We had not stressed the importance of only giving drugs that were demonstrated by clinical trials to be a proven benefit. Many primary physicians or family practitioners may in fact not use beta blockers because during the course of their training they may have been instructed to be wary that such agents might have led to deleterious effects. These therapies were proven to make patients live longer and have less heart attacks and have less strokes. I believe that these attitudes were predominant in the North American marketplace because it's a very competitive pharmaceutical marketplace.
We see probably 5 to 6 drug representatives a day in this office and try to give them some time in between seeing our patients to tell us about their medications, either new findings on older medications that have been available, or to explain to us the uses and benefits of new medications which the drug companies may have just developed.
In most professions, staying current with the latest information is a full-time job in addition to the regular workday. It's a daunting task for the generalist physician to remain completely up to date in every specialty, from the head to the toe.
Sometimes it makes more economical sense for the patient to be referred to a subspecialist sooner rather than later. For instance, a patient who has a cardiovascular problem that requires a certain diagnostic procedure or therapeutic procedure that internists or family practitioners just don't do. It would make no sense to drag that patient along. It would make no sense either financially or for the welfare of the patient to drag that patient along and not send them for the appropriate test immediately.
As our modern healthcare system evolves, more and more emphasis is being placed on the general practitioner. In the case of cardiovascular diseases, the current underutilization of cost-effective therapies highlights the need to help these physicians stay up to date with ongoing clinical trial information, or allow them to refer patients to a more specialized authority.
Does your health plan dictate your choice? What's at stake may be your life. We'll be right back on Today's Health.
Physicians don't get much sympathy from the general public. We're still complaining that they don't make house calls. But with all the clinical data that is being published, doctors face a quandary. How much time should I spend away from my patients to better learn effective treatments for my patients?
The great healers. Over the years, doctors have been revered in society as anything from saints to miracle workers.
These days, however, physicians are seen more as the mortals they are, and just like anyone else, they are susceptible to the same pressures and influences. Many factors can affect the therapies they select, including patient satisfaction, sales pressure, and a lack of time to keep up to date on clinical trial information.
It's very difficult and getting more and more difficult to stay up to date on all of the ailments that come through our office. Medicine is getting more and more complicated. There are more and more diseases being found. There are more and more diagnostic methods being done, and there are more treatments available for all the diseases, which makes it harder for, especially an internist who does all of internal medicine, including all the subspecialties that we have to be responsible for. It makes it more difficult for us to keep up to date. What we try to do to the best that we can as physicians is hear all sides of the story. We do listen to the drug representatives and we hear about their medicine, and then it's really inherent upon us to talk to the other drug representatives that tell us about the other drugs in that certain particular field that they feel are of benefit, and compare the two. We also, a lot of times, have to get outside the information about the drugs and go outside of the drug company representatives and talk to other physicians in the area or in the country, or attend conferences and hear about these things from physicians, and find out through physicians, which drug may be better to try to figure out where these drugs fit in our armament of pharmaceuticals.
General practitioners are vital on the front lines of our healthcare industry. However, there are many times when a specialist assistance could result in a more effective treatment, medically and economically.
There is an inherent risk in managed care programs of patients not getting properly referred to subspecialists because there is a financial restraint placed on either the physicians or the insurance company, depending on who takes the risks in certain HMO groups, in terms of sending patients to subspecialists. If patients get sent to subspecialists at too frequent clip, somebody's going to lose money in these HMO programs. I would like to think that the good HMO programs, the ones who are efficient and more ethical, will not give physicians a hard time when the time comes to send a patient, refer them to a subspecialist, and leave it to the physician to know when the appropriate time to refer to a subspecialist is.
Clinical trials consistently reconfirm that many long-standing, cost-effective cardiovascular therapies are effective at keeping patients alive who have had a heart attack or have hypertension. It's very important that specialists and generalists stay up to date on the data so they won't let something new seduce them from something proven.
Stay with us on Today's Health.
Drug researchers use the word submicroscopic. It's referring to the world they live in, a universe that's only seen under an electron microscope, and it must magnify it thousands of times. Understanding what goes on in that infinitesimal world may hold enormous potential for curing diseases that can devastate our world.
In order to unravel the mysteries of the universe, scientists often have to focus on the microscopic and submicroscopic building blocks. From a one-celled amoeba to a multifaceted human being, all life on this planet consists of complicated chemistry. Understanding the body's biochemistry stands out as a key factor in creating new drugs to deal with the diseases that can destroy human life.
In order to develop a safe and effective drug, we work to maximize the killing of the diseased cells while at the same time minimizing the harm to normal, healthy tissue.
One alternative to help improve the effectiveness and reduce the side effects of a drug may be in developing drug delivery technology using liposomes.
A liposome is a tiny bubble made up of the same ingredients that make up the cells in our bodies. We put very potent, toxic cancer drugs inside the liposome so that the cancer drug is kept away from the body's normal tissues but still available to attack tumors. After an injection, the liposomes circulate for many hours in the bloodstream. It's only where there's holes and gaps in the blood vessels that they can escape. Tumors create holes and gaps in the bloodstream near them. The liposomes escape in that region and are taken up by the tumor cells because the tumors think that this is food. Although what they find is that the liposome contains the drug that kills the cell.
This researcher working at Nexstar Pharmaceuticals is attempting to combine several technologies to make the liposomal drug delivery more precise.
We can coat them with molecules called oligonucleotides. An oligonucleotide is just a short piece of DNA. Each oligonucleotide has a unique shape. If we put the oligonucleotide on a liposome, it's like putting an address on a letter. It has only one place it's supposed to go.
The destination or target could be an HIV virus, an infectious bacteria, a cancerous tumor, or some other invader that's attacking a healthy system.
The point is to concentrate the drug into the site of tumor or infection so as to lower the toxicity and raise the efficacy.
Developing a formula that will destroy harmful organisms is only part of the challenge to drug developers. Improving the delivery of that medication can be just as perplexing. Well, hopefully advances in biotechnology will help us create better drugs and target them more precisely, because in the battle against terminal diseases, it's either kill or be killed.
Stay with us on Today's Health.
Germs can invade our bodies in any number of ways, and when harmful bacteria find their way into our urinary tract, they can cause a serious infection. Fortunately, we have weapons that can battle these invaders, and if you follow some simple steps, you may stop a minor infection from becoming a major problem.
You can find them everywhere. Bacteria thrive on land, in water, and in the air. Everything you touch, everything you eat, every breath you take puts some form of bacteria in contact with your body. But don't panic. Not all bacteria is bad.
Bacteria are one-celled or unicellular microorganisms of various shapes and sizes that either are free-living or live in a parasitic environment. They're important to us because they are a source of biochemical as well as pathological changes in the human host.
An infection is when a bacteria, one of the many strains or types of bacteria, are in a location in which they set up an inflammatory response.
Getting into the human body is virtual child's play for a germ. The eyes, ears, nose, mouth, and even skin offer easy, open-door access to the microscopic intruders. The urinary tract can also offer unrestricted entry to harmful bacteria.
The function of the urinary tract is to rid the body of harmful wastes. It consists of a kidney, which is a meaty, fleshy organ, which does the entire work. That is to say, the rest of the urinary tract is not needed to support life. The rest of the urinary tract is actually a conduit or reservoir that stores the urine until such a proper time that the patient can empty the bladder.
If an E. coli or a Pseudomonas or a Klebsiella, these are types of bacteria, if they get in the urinary bladder, as a rule, not always, but in a susceptible individual, then they will cause a tremendous inflammation with a whole set of symptoms.
There was naturally a lot of burning when I would urinate. Also, the pressure. My job, I'm on the phone all day sitting down at a desk, so there's that constant pressure.
It was a frequency, and that was the most uncomfortable part of it, having to, being up and down.
The body's natural immune system can fight and destroy much of this bacteria, but when the pathogens trigger an infection, it often requires antibiotics to eradicate those organisms.
95% of urinary tract infections can be very effectively treated with antibiotics.
Sulfas, trimethoprim, trimethoprim sulfa, quinolones, cephalosporins, nitrofurantoins. These are excellent compounds with classifications of antibiotics that are useful for treating urinary tract infection.
In general, women are more likely than men to develop uncomplicated urinary tract infections because their urethra is much shorter than that of the male, allowing the most common route of bacteria, that is, going from the flora on the outside up through the urethra to get into the urinary bladder. In the woman, it's very short relative to the long urethra in the male.
Battling pathogenic bacteria in your urinary tract is something your immune system does every day. You can become a valuable ally in this battle by practicing proper hygiene, which will help cut down on the number of these germs infiltrating your system.
If you happen to have had a urinary tract infection, you're not alone. Of all the bacterial infections, these are usually the most common. Every year they affect millions of people, but with careful diagnosis, appropriate treatment, and adequate follow-up, most urinary tract infections can be totally cured.
One time I was at a restaurant having a nice casual dinner, and suddenly that urgency hit me, and you had to go to the bathroom, and it was uncomfortable, naturally.
There are many types of bacteria that cause cystitis or urinary tract infections in general. The most frequent culprit is E. coli, which is, I mentioned, ubiquitously found in all of us in our gastrointestinal tract. When E. coli gets in the urinary tract, in many people, you're going to get this inflammatory condition known as cystitis.
Every year in the United States, urinary tract infections, or UTIs, account for over 5 million office visits and over 100,000 hospitalizations for men and women. A woman has a 40 to 50% chance of experiencing a UTI in her lifetime. At the very least, they are uncomfortable and can be very painful.
Very burning pressure.
After I felt the pain and the pressure and the burning, you always hope that it's going to go away on its own. So after about 2 days, when I really just couldn't stand the irritation anymore, I called the doctor and made an appointment, and he brought me right in.
Antibiotics exist that can attack and destroy the bacteria which causes UTIs. In most of the cases, the infection can usually be completely eliminated and won't reoccur. But about 20% of women who develop a UTI will have another episode.
How can one help the person who tends to get frequent infections, and they're documented infections? A physician can prescribe a low dose of a very effective antibiotic, such as a nitrofurantoin would be one, maybe a sulfa, maybe a quinolone, and at a low dose just at the susceptible period.
When it kept recurring as often as it had, he put me on a long-term antibiotic, I would say about 4 to 5 weeks. And I've been okay for about 4 months.
It's amazing how often we take the simple things in life for granted until they go wrong. A basic bodily function can become a major ordeal when the urinary tract gets infected. Fortunately, most of these infections can be cured, and hopefully, once they go away, they'll stay away.
As we find out more about the human body, it does become clear that we have so much more to learn. Will there ever be a time when we know everything there is to know about ourselves? I'm Kathleen Sullivan. Join us again next time as we get right to the heart of matters affecting your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.